My name is Dr. Greg FitzHarris. I'm a colorectal surgeon here at Sentara Surgery Specialists. We're located at the Sentara Careplex Hospital in Hampton.
I'm John Sayles. I'm a colorectal surgeon with Norfolk Surgical Group, and we're based in Norfolk, Virginia.
My name is William Rudolph. I'm a board-certified, fellowship-trained colon and rectal surgeon working in Virginia Beach, Virginia. Nationwide, over the past many years, there's been a trend toward specialty services. There's two things that improve results. One of those things is fellowship training. So if you train with the best, you have a chance to be the best. And the second thing is a volume. The more of something you do, the better you get at it. Board-certified fellowship-trained surgeons like Sentara has see more of these different disease processes that we're used to dealing with, and that translates into better results.
I think having colorectal surgery within the Sentara Medical Group, and specifically within Sentara Surgery Specialists, is a definite benefit to the patient. People can access a colorectal surgeon on the Southside as well as the Peninsula, and 3 different practices within Sentara Surgery Specialists. The colorectal surgeon has a deeper understanding of these disease processes that involve the pelvis, colon and rectal, and anal type conditions, and it's that extra training and expertise that I think really brings the benefit home to the patient.
I think quality health care is what everyone strives to do in Sentara and throughout, and I think it really just means being very attentive to the patient and to the details of the patient and having a good team approach to the care of the patient. I think the biggest thing is communication between the different people that are involved, be it the primary care, the gastroenterologist, the oncologist. It really involves good, close communication. Being part of a big group with different specialists involved really makes it very easy to coordinate that care between the different doctors, and certainly having the availability of e-care and the electronic record already is facilitating information transfer between the physicians and coordination of that care.
Colon and rectal cancer is pretty insidious. In other words, you usually don't know that you have it. Therefore, it's absolutely essential to have screening or surveillance colonoscopies to try and pick up precancerous lesions called polyps before they progress to colon rectal cancer.
Part of doing appropriate surgery for cancer of the colon involves a large enough resection to encompass enough lymph nodes to determine the actual stage of the tumor. Nationally, it's been determined that approximately 12 lymph nodes is an adequate amount to resect.
A cancer conference is a collection of physicians and nurses and other professional people who are involved in the overall care of a cancer patient. And it can be done prior to the patient having surgery or after the patient has surgery. And it's a discussion really to determine sort of the best care to be done for that individual patient.
There's a couple of different modalities that are pretty much specific for colon and rectal surgeons. They can be diagnostic modalities. It is standard of care for rectal cancer surgery to have preoperative radiation and chemotherapy. We offer in our offices what's called transrectal ultrasound. These are ultrasound devices specific for the rectal wall to try and figure out if you're a candidate for rectal cancer preoperative chemoradiation.
TEM stands for transanal endoscopic microsurgery. And this is a procedure that's been available in the United States for about 15 years, but it has not been well publicized, nor has it been espoused by very many colorectal surgeons. But it does really provide an excellent opportunity for a patient to undergo a procedure that's minimally invasive. It's part of what's known as the natural orifice surgery, where a procedure is done through an opening in the body already, so essentially leaves no scar. So a patient might be referred to me with a rectal lesion that otherwise could not be removed through the anus because it's too far up. With this technology, it allows me to reach higher up into the rectum, remove the whole lesion, sew it up, and then the patient typically can go home same day. Part of quality health care, I think, is working as part of a multidisciplinary team. No particular physician is an island. We have to work within the system. And I think within the system here at the Careplex Hospital and within Sentara, we have a very good team. Within colorectal surgery, we have in particular a benefit with a colorectal nurse specialist, who is essentially what I consider the colorectal concierge. And she essentially takes the patient from the very beginning to the very end with respect to every step of their care, and can help them with a multitude of different problems as I'm helping them with the surgery. I think it's that team approach that really provides the professionalism and the excellent care that we can provide.
Well, I think, we're in the business to help people. And I think that's one thing that Sentara tries to promote with its physicians, is this idea of, we're here to help the patient, and you always have to remember that. At Sentara, I think it's our goal to educate, to correctly diagnose, and to treat within the standard of care, and actually we expect a little bit more than the standard of care.
People understand that when they come to a Sentara physician, they're going to see somebody who is expertly trained, who's not only courteous but very professional, provides excellent top-notch care. The facilities, as I said, also provide state-of-the-art technology. So I think the person who comes to a Sentara facility knows that they're getting the best that they can.